Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Gestational diabetes. Introduction. Diabetes is a disease that makes it difficult for the body to control blood sugar levels. Diabetes that starts during pregnancy is known as gestational diabetes. Around 5% of women experience diabetes during pregnancy. Gestational diabetes usually goes away after the pregnancy is over, but over 1/2 of women with gestational diabetes will develop type 2 diabetes later in life. Gestational diabetes can be dangerous for both the mother and baby. Getting diagnosed and treated can help prevent complications. This program will help you understand gestational diabetes. It covers how it is diagnosed, treatment options, and what to expect during and after pregnancy. Diabetes. Gestational diabetes is temporary and only happens during pregnancy. It is similar to other forms of diabetes. This section reviews information about diabetes. Diabetes makes it difficult for the cells of the body to make energy. The body is made of millions of cells that need energy to function. The food you eat is turned into sugar, called glucose. Sugar is carried to the cells through the bloodstream. It is one of the many substances needed by the cells to make energy. For glucose to enter the cells, two conditions must be present. First, the cells should have enough doors, called receptors. Second, a substance called insulin is needed to unlock the receptors. Once these two conditions are met, glucose enters the cell and is used by the cell to make energy. Without energy, all cells die. Insulin is a chemical hormone. It is made in the pancreas. Insulin levels in the blood vary with the amount of glucose present in the blood. Diabetes is a disease that makes it difficult for the cells of the body to get the glucose they need to make energy. Gestational diabetes. Gestational diabetes happens about 20 to 28 weeks into a woman's pregnancy. It usually goes away after the pregnancy is over. Like other forms of diabetes, gestational diabetes happens when the body does not use sugars correctly. Gestational diabetes happens when the mother has high blood glucose levels during pregnancy. During pregnancy, some of the hormones that the placenta makes may prevent insulin from being as effective. The pancreas usually can make more insulin to break down glucose during pregnancy, but in gestational diabetes, the pancreas cannot make enough insulin. A mother's glucose levels can affect the fetus's glucose levels. Too much glucose in the baby's blood can cause problems with the pregnancy. The baby's pancreas also makes insulin. The insulin changes glucose to fat. If the mother has high glucose levels, the baby will be born with more body fat than normal. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risk factors. Healthcare providers may not be able to predict who will get gestational diabetes and who will not, but they do know factors that can increase a woman's chances of getting it. These are known as risk factors. Some risk factors you can control, others you cannot. Women without any risk factors can also have gestational diabetes. Pregnant women who are older than 25 years old are more likely to have gestational diabetes. Women who are overweight are at an increased risk of having gestational diabetes. Once a woman has had gestational diabetes, she is more likely to have it again in future pregnancies. Women who previously had a baby weighing more than 8 pounds and 13 ounces are at an increased risk for gestational diabetes. Gestational diabetes is also more likely to happen in women who have a close relative with diabetes. Women who have had problems in a previous pregnancy are at a higher risk of having gestational diabetes. Examples of problems include stillbirths or birth defects. Women who are of Native American, Asian, Hispanic, African American, or Pacific Islander descent are at an increased risk. Women who have polycystic ovary syndrome, or PCOS, are more likely to have gestational diabetes. A woman may develop gestational diabetes without having any risk factors. If you are 24 to 28 weeks pregnant, you may be tested for gestational diabetes. Diagnosis and testing. Even if you have no risk factors for gestational diabetes, you may still be tested. This is because there are often no symptoms for gestational diabetes. In rare cases, urinating often or feeling thirsty may be symptoms. If you have many risk factors, you may be tested before the normal 24 to 28 week window. A test called a 1-hour glucola may be done. You will be asked to drink a syrupy, flavored solution over a 5-minute period. You will not be able to eat, drink, smoke, or chew gum for 1 hour. Small sips of water are okay. 1 hour after drinking the solution, your blood will be taken to test your glucose level. If the blood glucose level is within normal limits, no further testing will be done. If your glucose level is not normal, you will then be asked to take a 3-hour glucose tolerance test, or GTT. The GTT test requires that you fast or not eat overnight. Your blood glucose will be measured before the test begins. After fasting, you will be asked to drink another syrupy solution that has a higher concentration of glucose than the drink from the previous day. Your blood glucose will be drawn at 1 hour, 2 hours, and 3 hours during the test. Results are usually available the same day. Additional tests may be ordered by your healthcare provider to check the health of the fetus. These may include non-stress test, biophysical profile, or BPP, fetal kick counts. A non-stress test includes placing sensors on your stomach. These sensors connect to a monitor that measures the fetus's heart rate. The BPP test combines the non-stress test with an ultrasound. This lets the healthcare provider evaluate the baby's heartbeat, movements, breathing, muscle tone. This test also measures the amount of amniotic fluid surrounding the fetus. Fetal kick count is a test done at the same time as the non-stress test, or BPP. This is simply counting how often the fetus kicks over a set period of time. The fetus may not be getting enough oxygen if it is not moving enough. Treatment. Treatment for gestational diabetes depends on how difficult your blood sugar is to control. You will likely have frequent appointments with your healthcare provider to check your blood sugar levels. To manage your gestational diabetes, you will need to follow a special diet, exercise, check your blood glucose levels. Your healthcare provider may refer you to a nutritionist or dietitian. They will help you learn what foods to eat. Following your diet carefully is important. Regular exercise will help keep your blood sugar levels normal. Check with your healthcare provider before beginning any exercise regimen. You may be asked to check your blood sugar every day. Your healthcare provider may refer you to a diabetes educator to teach you how to check your blood sugar. You should record all blood sugar levels in the log provided to you. If diet and exercise do not control your blood sugar, then oral medications or insulin may be needed throughout your pregnancy. 80 to 90% of women with gestational diabetes can treat it successfully with diet and exercise. Effects during and after pregnancy. There are many consequences of having gestational diabetes, both during and after pregnancy. Some of these effects may be avoided if you follow your healthcare provider's treatment plan. Managing your blood sugar levels is important for both yourself and your baby. High blood glucose levels increase the chances of having a large baby. This increases the likelihood of delivering the baby by C-section. Gestational hypertension and preeclampsia are more common in women with gestational diabetes. Both can cause life-threatening complications for the mother and baby during the pregnancy and delivery. If your blood sugar levels are not well controlled during pregnancy, the baby may have low blood sugar and breathing problems shortly after birth. Severely low blood sugar may cause seizures. A baby is more likely to have jaundice if the mother's gestational diabetes was not controlled. Most cases of neonatal jaundice go away without treatment and are not serious. Over 1/2 of women with gestational diabetes will develop type 2 diabetes later in life. For many women, this risk can be reduced with regular exercise and weight loss. Women who have had gestational diabetes should be screened regularly for diabetes. You should be screened 6 to 12 weeks after delivery and at regular checkups. Make sure to let your healthcare providers know about your history of gestational diabetes. Women who have had gestational diabetes and had a normal glucose level after delivery should have their glucose level checked at least once every 3 years.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Diabetes is a disease that makes it difficult for the body to control blood sugar levels. Diabetes that starts during pregnancy is known as gestational diabetes. Around 5% of women experience diabetes during pregnancy. Gestational diabetes usually goes away after the pregnancy is over, but over 1/2 of women with gestational diabetes will develop type 2 diabetes later in life. Gestational diabetes happens about 20 to 28 weeks into a woman's pregnancy. It usually goes away after the pregnancy is over. Like other forms of diabetes, gestational diabetes happens when the body does not use sugars correctly. Gestational diabetes happens when the mother has high blood glucose levels during pregnancy. Healthcare providers may not be able to predict who will get gestational diabetes and who will not. Women without any risk factors can have gestational diabetes. There are often no symptoms for gestational diabetes. In rare cases, urinating often or feeling thirsty may be symptoms. If you are 24 to 28 weeks pregnant, you may be tested for gestational diabetes. Your healthcare provider may also recommend that you be tested earlier if you are at high risk of developing gestational diabetes. To manage your gestational diabetes, you will need to follow a special diet, exercise, check your blood glucose levels. There are many consequences of having gestational diabetes both during and after pregnancy. Some of these effects may be avoided if you follow your healthcare provider's treatment plan. Managing your blood sugar levels is important for both yourself and your baby. Thank you for using Explain.